Good evening to all our friends on Facebook, all our friends and partners around the world watching us live on our Facebook and also on our YouTube channel. This is Reverend Dr. Aquilus Ricks, founder and president of AfriAge. AfriAge is an acronym for Africans for Restoration of Ethics in Government. We are a nonpartisan organization that harnesses the expertise of professional Africans and non-Africans to discuss issues significant to the continent of Africa. More importantly, we look at the careers and the area of expertise and how that area of expertise and career can be a blessing to our brothers and sisters in Africa. And so we want to welcome you to our platform. We're excited for our guest that we have today. It's an honor, it's a joy. I've been knowing her for a long time. And so we want to welcome to our platform today, Miss Samlaree Birch. She has a bachelor's degree in special education from DePaul University. She has a master's degree in special education with emphasis in literature instruction from Riley Graduate School of Education. She's licensed to teach kindergarten to 21 years of age. And currently she teaches at the Rauner College Prep High School in the Chicagoland area. Miss Birch, welcome to AfriAge.
Hello, happy to be here.
Wonderful, wonderful. We're going to be discussing with you something that is so important. Obviously, something that you are passionate about. And that happens to deal with special education. And we entitled this session, Addressing Special Education in Africa. Can we just dive in?
Absolutely.
Wonderful,
Absolutely.
wonderful. You know, when you hear, when I hear the word special education, as our viewers out there, when we hear special education, we have so many different, thoughts that come to mind. What's the difference between special education and general education and things like that? So I want you to just share with us as we start this session, what is special education?
Absolutely. So special education, just using the name in this definition, special education is specialized or individualized education. So it's different from general education because students who qualify for special education receive an IEP, which stands for Individualized Education Plan. So when a student is in special education, they receive a curriculum that is tailored to their specific need and their specific disability. So that individualized education plan is a legal document that is given to any student within special education, unlike general education, that details all of the modifications, all of the accommodations, all of the things. The IEP is like 20 pages long that the student needs to be successful in the classroom setting. So if you're in the general education setting, you don't receive the IEP, but in the special education world, you are given this individualized education plan that individualizes, that specializes your education or your specific curriculum, your meaning that student's specific curriculum to their need, to their disability.
Does it include people with, like, for example, let's say cognitive developmental issues, slow to learn? I mean, is that, because you mentioned the word disability, so I just want to understand a little bit more.
Absolutely. So there are a list of, and my professor would probably be a little mad at me right now because I can't list all 13 off the top of my head, but there's a list of 13 different categories that are laid out in the law that may qualify a student for special education. So that is Down syndrome, autism, ADHD. There's some disabilities that's just a cognitive delay where the student doesn't have autism or ADHD, but their mental abilities are delayed. There's specific learning disabilities just in reading. Some students, their disability, they just struggle with reading. They're really good at math, they're really good at science, but their disability is specifically in reading or specifically in math. There's so many different disabilities that qualify a student for special education, excuse me. And it can just, it ranges. There's so many different, there's 13 different categories that are listed within the IDEA, which is the law that protects students with disabilities in America.
Wow, wow.
Mhm.
This is an interesting field of study. You know, when you think about special education, the next thing that comes to mind is how do you, in this field, how are students classified? I know you alluded to it already, but maybe you can chime in a little bit more. How are they classified? I mean, is there something specifically you're looking for? You know, because you don't want to misclassify students, right? I mean, you want to make
Absolutely.
sure, you know, because if you're putting together an individual plan per student,
Mhm.
I mean, that is in depth. That you got to be cautious. You got to be most intentional, specific. So how will you determine, to classify a particular student and put together a plan for that student?
Mm-hmm. There are three ways, or there are three tracks, and I'll explain each one. The third one kind of overlaps the first two. So the first one is, it starts with a diagnosis. So there are some students that at birth, once the mother gives birth to that child, they're born with Down syndrome, or they're born with autism, or they're born with this disability. So automatically from birth, the parents or guardians know that once that child hits school age, kindergarten, they're going to need specialized services. So that parent takes that diagnosis from the doctor that they knew from birth. They sit down with a team of professionals, special educators, the school nurse, school psychologist, speech therapist, general education teacher, and they sit down as a team, and they determine what is best for that student. Now they're doing this determination based on educational benchmarks, which these professionals, they study this, right? So they know at first grade, students are supposed to be doing this. At second grade, students are supposed to be doing this. There's a range, but of course, students are supposed to be following a certain educational benchmark. They're evaluating the student based on their peers. How are they interacting with their peers? How long are they taking on assignments as opposed to their other peers? That way starts with the diagnosis first. But some students don't have that diagnosis, right? So the parent can't come to the school in kindergarten and say, I know that my child has Down syndrome. I know my child has a cognitive delay. They can't come to the school with that. So the second way is a recommendation. So sometimes students may be in seventh grade, and the general education teacher, this student has not been in special education. The general education teacher sees that this student is in seventh grade maybe, but they're reading at a fourth grade level. This student is in seventh grade and their interactions with peers is not aligned to the way other students are interacting with peers. This student is taking 30 minutes on an assignment that was supposed to only be 2 minutes. This student is not hitting those educational benchmarks that teachers or educators know if they've been in the field for a while. When they study it in school, we know these educational benchmarks. And if that student is not aligned to those benchmarks, then the general education teacher takes that not evaluation, but that recommendation to the parents and says, okay, I'm noticing these things with your child. We're going to implement a tiered intervention. So it's pretty long. So after they start with that recommendation, they go into a tiered intervention, which there are 3 tiers. Where they offer the student extra support, such as after school programs, office hours, tutoring. That's the first step. They offer the student tutoring, office hours, extra help, and see, does that work? If that is still not working, the student moves to tier 2 or tier 3, If those tiers of interventions are still not working, then we sit down as a team with parent consent to follow up with a formal evaluation. Now, the formal evaluation is when all of the professionals come around, the school nurse, the school psychologist, the speech therapist, the physical therapist, and then they evaluate the student in the classroom and outside of the classroom. That evaluation leads to a diagnosis. That diagnosis leads to an IEP, the individualized education plan. So it's a
So
pretty long, yeah.
yeah. I mean, so it's in essence, I mean, it's a delicate process to be able to come up with an IEP, as you're saying. It's a delicate
Absolutely.
process.
You can't just place a student in special education. There is, the process is a bit shorter if the student was born with the disability. Well, most students are born with a disability, but some of them aren't as obvious at birth. Some you see later in the school setting, or you see later when they're older. So yeah, it's a pretty long process, and you don't just jump to it. You have to go through those tiers. You have to be evaluated. Teachers have to take data, nurses, school psychologists, they have to take data on the student in the classroom, outside of the classroom, before placing the student in special education.
Wow. Well, I want to think now about the teachers, such as yourself, because I think you have to be passionate, to go into this the era of career, and you have to love, those students that's placed in these areas of education. For the teachers, again, with your expertise and knowledge, what is required of teachers who commit to educating students in this area? I mean, because it's not, it seems like general education.
Oh no, it's very different.
So what are some of the things that you teachers have to be trained and be knowledgeable in to handle these students and give them a future? Because that's what you're trying to do, to give them a future. Yeah.
I think before I list those things, I think that one of the main things is a degree in training. Like you need that degree. Not everyone can wake up one day and be a special educator. Not even someone that got their degree in general education can be a special educator. I would argue you need that degree specifically in special education to be able to service these students in the right way. Once you do have that degree, I believe that teachers who commit to it, I think one of the first things that you need is creativity. Just being creative. There's a shift in mindset that you have to have when developing lessons that are set up for students, that set students up for success. I'll give you an example when I talk about creativity. There was an assignment that I saw that the general education students were doing that was 8 sentences long. They took this 8-sentence paragraph and they had to read this paragraph. It was out of order. And the topic was logical sequencing. So the paragraph was out of order, and they had to take this long paragraph and rewrite the paragraph in the way that follows a logical sequence. Now, the special educator looks at this assignment and says, my students that have disabilities may look at this text and feel discouraged because it's too long. They may look at this text and say, you know what? This is really hard for me, and they may shut down. How can I, as a special educator, using my training, using my degree, be creative in a way that services these students? So what did I do? I looked at this paragraph that was really long. I knew that my students were going to shut down, give up, and struggle with this. And I cut up in little strips of paper, each sentence into 8 little strips. And I had students rearrange the strips of paper in a way that was logically sequenced so that students could focus on each sentence at a time instead of looking at the paragraph as a whole. And I do feel that creativity in whatever the lesson is something that teachers that do commit to students with special needs, teaching students with special needs, need to have. I also feel that they need to have patience, and not just patience with students acting out, but patience with students. I have a student this past year, I had a student this past year that it didn't matter no way that I explained a certain topic. They just weren't understanding. They weren't understanding. They weren't understanding. And I had to have patience with him and patience with myself in a way that I had to develop a new way to service this student specific to his disability. And that came with patience. I could have given up and said, you know what? He's not understanding, so be it, but I didn't. I had the patience with him, and I had the patience with myself to really keep going and finding a way to help this student. And then also, I feel that teachers need high expectations. And this is just one of the things. Just because a student has special needs does not mean that you lower the bar for them. You need to set your standards high for them. Just because they may be reading at a first grade level and they're in high school, you don't give them a baby book. You set the expectation high for them, even though they may be struggling. And yeah, I think patience, high expectations, and creativity, as well as passion, and that degree in training is essential for teachers, adults who commit to teaching students with special needs.
Wow, this is amazing. I'm so glad we are having this conversation. I want to shift our focus a little bit now on Africa, because part of the vision of AfriEdge is that we tailor our expertise and careers experiences to Africa and see how we can help. We can help. And I just as I look and listen to what you just said and think about some of the challenges that we have going on in Africa, whether it's high rate of poverty, whether it's stress, due to unemployment and things like that. It makes me, I personally believe that many of our kids there are dealing with challenges, mental challenges cognitively. I really believe that. I think, when you have unemployment, poverty, and the stress that comes with it, if it's impacting the adults, I certainly believe it's impacting the children as well. Well, and the thing about now, if this assumption is true, if what I'm assuming is true, that children are being impacted because of the social things that's happening in Africa and economic things in Africa, what suggestion you would give, to those going to this field? I mean, I know you already hit on some things just when you talk about the expectations, the patience, I'm sure it overlaps. But I mean, is there anything else you think, how can they start to address this need? Because, I mean, if there are a lot of students going through this thing mentally, and libraries I mean, do not have functioning library in most places, you know what I mean? So access to books and things like that, reading skills are low and things like that. I mean, where does the teacher in Africa start, to be able to look at this era of special education and students in these categories?
Yeah, when I think about this question, it's a little tough because when
Yeah.
you think about special education, that's one area. But then when you think about the educational system as a whole in Africa, there's so much despair right now. When we think about education as a whole in Africa, there's a lack of resources. The schools, the infrastructure of the schools is poor. The teachers aren't being paid. There's so much with the overall educational system right now as a whole, that when you think about special education, it's like, oh my goodness, we need to first figure out the educational system in Africa first, but when in a perfect world, where we said, the educational system in Africa is like skyrocketing right now. I would send, in a perfect world, I would send people to Africa to train people. Like I said earlier, I do not think that teachers can wake up tomorrow and say, I'm teaching special education. I would send trained professionals to really train teachers in the field of special education. There is truly a shift of mindset that happens in the special education courses that is not taught in the general education courses that is so important. I know there's a course that you take in special education that the whole year you're just learning disabilities. How does it look? How does it look in the classroom? How does it look outside of the classroom? So that you're properly prepared. In a perfect world, teachers will receive thorough training from professionals to know how to address these issues with the provided resources, of course. I also think that in Africa, there's a lack of funding in the educational system. And if there was more funding so that teachers could be paid appropriately and they could have the books and the papers and pencils and technology, they could really help these students. I know, for example, I have some students that need certain devices to be able to be successful in the classroom. So if a student is in Africa and they're nonverbal and they need a way to communicate, if there was a way that they could type up what they wanted to say on an iPad, for example, that would be an amazing way to have this student be successful in the classroom. But I think it first
Wow.
starts with the training.
Yeah,
Yeah.
yeah. I like how you address that, because before you start looking at these specialized areas, you want to
Mhm.
look at the general system of
Absolutely.
education,
Absolutely.
and having that foundation laid first, then you
Mhm.
can branch off into these areas to do that.
Mhm.
But and unfortunately, the challenge is, the mental challenge is not waiting for you to have a system in place. You know what I mean?
Exactly.
It's not waiting. So,
Exactly.
that ties in with the final question I would have for you on this segment as we talk with you concerning addressing special education in Africa.
Mhm.
Um, because the mental health needs of children are not slowing down,
Mhm.
even though you don't have the education system in place. What advice, if you were to speak to lawmakers or policymakers, what are some things you would like to see concerning this area that you love so much, special education, included in laws that will help, develop this area in Africa?
I feel that one of the first thing that I would say to lawmakers and policymakers is allocating a bigger budget for education. I think that that is one of the main
Mhm.
things, pouring into education. Education is the foundation. Our children, our teenagers, are our future. Education is the foundation of everything. Everything that we do, every lawmaker was educated in some way. Every policymaker was educated in some way. Our children are future business owners, our lawyers, our doctors. The education is so important. And I think I believe the first thing that I would take to lawmakers and policymakers is allocating a bigger budget for education to improve the schools, to be able to pay teachers, to be able to train teachers in the way that they need to be trained, paying teachers, fixing the school buildings and the infrastructure of buildings in Africa, so that the students have good buildings to go to, and good resources, proper books, proper pencils, papers, all of the things that they need to be successful so that they can learn, because education is so important. And if literacy rates are low, the country will never advance. Reading is so fundamental. And I may be a little biased because I'm a reading teacher, but literacy rates are so, so, so important for the country to advance. And if money and funding is not poured into education first, I do believe that if it's not done, the country will never improve or advance in the way that it needs to.
Well said, well said, well said. There is so much. I just concur with everything you just said, and I'm an advocate for that. That there has to be investments in education. What is the, provide scholarships, as well. Yeah, get those interested in education and teaching, properly train, degrees and things like that. And then you mentioned the payment too. Give them compensation, just compensation that will enjoy doing what they're doing. Because if someone have to teach, but then they don't have enough, and then they got to leave and go do something else, it just you wanted to focus on preparing the next generation,
Absolutely,
generation.
100%.
And so I agree 100% with what you just said. Well, time goes so fast here when we're
I
having
know.
these dialogues and these interviews. It's just been a joy having you and tapping into your knowledge, skills, and your expertise in this very, very important area of special education. Any final thoughts that you want to leave our audience before we conclude our session?
No, thank you for having me. I'm very, very passionate about special education, especially special education in Africa. So thank you so much for having me. Thank you.
Well, folks, we want to say again, this is Reverend Dr. Aquilus Ricks with AfriH. Our featured guest was Miss Samlaree Birch, talking to us and sharing her knowledge and her experience in the area of special education and how Africa can benefit from this area of expertise that she has. We want to thank you all again for joining us. And as always, we want to leave you with a motto of our organization: doing better by doing right. We believe Africa can do better if she simply does right. Thank you all. Have a good night and see you next time on AfriH. Thank you, Ms. Birch.
All right.